Hi everyone, I'm Dr. Coulter.
And I'm Autumn.
And today we want to talk about our annual physicals.
So with our annual physicals, we usually have patients come in every single year and we just go down this preventative checklist.
And when you come in for our preventative visit, then you're going to get a very inclusive and comprehensive annual physical that you probably won't get anyplace else. So we're going to walk you through some of the things that are a little bit different. So Autumn, what would you say is different about what we do compared to what everyone else does?
So I would say that probably starts whenever you first come to the back. We'll have you go ahead and change into a robe so that we can go ahead and get an EKG done. The purpose for the EKG is just kind of a screening test for your heart. It can pick up on some arrhythmias or abnormal heartbeats, or sometimes it can start to pick up on some heart disease before you even get symptoms.
Okay, well that's really good. And then the other thing that we do is we do something called a max pulse. And a lot of people haven't heard about that, but it's literally a monitor that goes on your finger and it looks for vascular disease. So that's when you hear about people who have, quote, poor circulation and blood is not getting all the way to the organs that it's supposed to get to. And so if we find this early, we can actually do some things about it and you won't end up with vascular disease or hearing about those people who, as they got older, they had to have an amputation of their toe or things like that because they didn't have good blood flow to it. So we're screening for that really early in you as well. Anything else you would say is different, Autumn?
Definitely our lab work.
Okay.
Our lab work is very, very comprehensive. It has all of the normal things. We still screen for diabetes, cholesterol, thyroid. However, we take it one step further. And so we go a little bit past that. We look for vitamin deficiencies like vitamin D, vitamin B12, normal ones that we should get from our diet, but sometimes we don't do the best at doing it. Also, sometimes our bodies just don't necessarily want to absorb vitamin D like they should.
Yeah.
And so we check for those things. We go a step further. We check for reproductive hormones just to kind of track to see if there's any low testosterone, PCOS, kind of conditions that may run under our purview until we actually take a step back and look at them.
Yeah, and people want to know about their thyroid health, so there'll be like your thyroid hormones, which are like TSH, T3, and T4. And then even so, we all should get checked for HIV and hepatitis C, so that's part of our panel too. Mm-hmm. So I think when people leave here, they have a really good picture of their health and they know about their heart health, vascular disease, and we pick up on hormonal issues and other entities like diabetes, high cholesterol, things like that. So this is not like any other physical that you've had. And I think when patients leave here, they always say that, right? Mm-hmm. So what about the robe? Is it what would you say about the robe? I feel like our robe is like one of the best robes ever. Yeah. So it's like spa-like, right?
Yeah. Instead of like the thin OB-GYN ones that kind of rip maybe, or do you just
paper? Yeah, we don't do paper. We don't do paper at all. So you'll have a nice spa-like robe when you come in. It has our F.A.M logo on it. The staff makes you feel really comfortable. And because this is comprehensive, definitely make sure that you're fasting before you come in so that your labs can be accurate. And when you leave here, I'm sure you will say, this is the best physical that I've ever had.
For sure.
Okay, the next thing we want to talk about is kind of how this plays into what your insurance covers and what they may or may not cover. And so I know a lot of people say, you know, I got a good job, which means I should have good insurance and my insurance should cover everything. Is that really true, Autumn?
I wish it were true, but unfortunately no. Insurances can basically decide what they do and what they want to cover. However, doctors also, or providers also, are able to decide how you as a patient need to be treated.
And unfortunately, insurance's goal is not to make sure that you have the best health. They're really just there to make sure that if something does happen to occur, that you do have help in covering it. And so we like to make sure that patients understand that when you come in for your annual physical, part of that is a yearly checkup, and it's really just to make sure we give you the good thumbs up and say everything's good to go. But unfortunately, that doesn't always happen when people come in. So there are things that we might find on an exam that the patient didn't even know about before. And so some of those things, Autumn, what would you say?
I would say the one that's probably the most common is high blood pressure. So you come in and your blood pressure may kind of be on the edge. We actually recently have decided that now anything like 135/85 is high blood pressure. it is very rare to have symptoms whenever you're 135 over 85, but God forbid we don't catch it then, it progresses to where it is uncontrolled, you have symptoms, and then you could have organ damage from it too.
Right.
But if you don't stop and treat it at that preventative visit, God knows where you'll be at like 6 months later.
Yeah, so things like high blood pressure we might pick up at that particular visit, or obesity is another thing we might pick up at that particular visit, or your heart rate being really high and you didn't really know that, so we might pick that up. And like you said, the EKG really helps with that too. And so people say, well then what's covered and what's not covered? And unfortunately, doctors' offices don't always know what your insurance will or won't cover. You know, we hope that they will cover everything, but some of the things that we do really, really special for patients, like the EKG to check your heart and that max pulse that we talked about, some insurances like to play the game of not wanting to cover it, but we think that it's for your best interest to have it done, because that's the only way you're going to know if something's really going on with your circulation or with your heart. And sometimes there may be an additional fee for that particular aspect of your physical to be done. When you walk out of here, even if it's an extra $30 or whatnot, it's really important that when you leave, you know everything about your health. You know, so unfortunately costs can come into play, but our office does a really good job of educating people, would you say? Anything else you want to talk about when it comes to like cost-wise that people might be surprised about?
I would bring up some of the labs. So for example, one of the vitamin deficiencies that we choose to check every single year is vitamin D. It is super, super common nowadays to be vitamin D deficient, especially because we just don't go outside like the hunter-gatherers did back in the day. And so a lot of people are vitamin D deficient. However, insurance only sometimes wants to cover that exam or that lab if you already have that diagnosis of vitamin D deficiency.
And unfortunately,
we are to know that you have vitamin D deficiency without checking is beyond us.
Yeah.
But that's just one of the examples where we are checking for abnormalities, but the insurance has decided that because you've never been diagnosed with an abnormality, it shouldn't be covered.
Yeah. So once we do find it,
then it's covered.
Then it's covered, which is crazy when it comes to insurance. But I think in the end of the day, it's really good for patients to know, because there's so many other things that they may not feel, or they just may not feel right. But then they find out like, oh, I had a thyroid issue or the vitamin deficiency, and not just vitamin D, but we check B12 and iron levels, folic acid levels. So when people leave here, they have a very comprehensive lab, but there may be a bill from the lab company. So remember, there's something different with your doctor's visit, and we bill for the visit, and then you may also get billed from the lab company for those particular labs that are there. But at the end, you will definitely know everything about your health based on that comprehensive lab test that we do.
Oh, for sure.
Yeah. So I think that this was really good for us to be able to have a talk about what happens in the physical, what to expect at the physical at F.A.M, because I promise you, you will not get a physical like this anyplace else. And then also when it comes to billing, what you should expect from that standpoint as well. But remember, this is only once a year. So even if it is an extra $30 or so, then I think that's well worth knowing that you are healthy when you walk out of here, or the things that we need to do to make sure that you get to those health goals that you have.
I completely agree.
Okay, well, we look forward to seeing you guys here for your preventative. And if you have any questions, make sure that you contact F.A.M or ask one of our staff when you walk in, and they can help walk you through what to expect and explain to you where costs may occur.